Hello dear participants, this is A.S. Kulkarni. Welcome you on this presentation Introduction to Clinical Pharmacy. In this presentation, we will concentrate on introductory part. Learning outcomes of today's presentation are: after completion of this presentation, you will be able to understand the clinical pharmacy and its scope. Also, you will be able to know the objectives of a clinical pharmacy. Roadmap of today's presentation: first we will go for the introductory part. Afterwards, we will move to the scope of clinical pharmacy. Then we will go for objectives of clinical pharmacy, and at last we will see healthcare team. You can see in this picture. So here is a clinical pharmacist who is advising to the physician, nurses, as well as counseling to the patient. So clinical pharmacy is related to the patient. So it is nothing but the patient oriented service, whereas hospital pharmacy is an product oriented service. So clinical pharmacy is a new aspect. One should have knowledge for effective use of drug, about its uses and adverse effect, drug interaction and the self medication. So you just remember, so clinical pharmacy is an patient oriented services. So here clinical pharmacist will monitor the patient, his condition, recovery rate, as well as he will counseling to the patient about the medication, and also assist to the physician to select the right choice of drug for that particular patient, and guide to the nurse for route of administration, timing of the drug or the medication to the patient, etc. So patient counseling is done with the patient. So here pharmacist should adopt that particular ability to move that patient with the compliance. So clinical pharmacy is an branch of pharmaceutical science which deals with various aspects of patient care, not only dispensing of drug but advising the patient on rational and safe use of the drug. So here clinical pharmacist or the clinical pharmacy is advising to that particular patient for safe and rational use of the drug, and also assist to the physician to write the prescription with the right choice of drug. So this is the introductory part of clinical pharmacy. Let's move to the next. So before going to that point, here is a reflection spot for you. What is the scope of clinical pharmacy? You just pause the presentation, try to write the answer for it, and then play the presentation. Yes, you are right. Let's see. So here we will see the scope of clinical pharmacy. So the first scope is there, that is evaluation and selection of drug. So here clinical pharmacy is evaluating the drug with the help of biopharmaceutics. So here therapeutic equivalency of a different dosage form is evaluated. So this evaluation is done by using the biopharmaceutics. So it can give unique services in the selection of drug. So after evaluation, here pharmacist will assist to the physician for medication to that particular patient. So here the then first scope, that is the evaluation and selection of drug. Let's move to the next scope. Here the drug information. So the use of information retrieval technique to make any data available in efficient manner. So here clinical pharmacy is storing the data bank related to the drugs as well as the therapy. So here clinical pharmacy acts as a drug source information or drug data bank. So here the DIC, that is Drug Information Center, acts as a data bank with the clinical pharmacy. So here pharmacist is responsible to collect authentic information and store in the DIC. So that here the pharmacist also responsible to provide the authentic information to the healthcare. So scope of clinical pharmacy is to the drug information, that is the authentic drug information. So here is a third scope, that is drug utilization. So here clinical pharmacy help in study of drug abuse, drug misuse and the medication as well. So here drug utilization is evaluated or which is taken in the consideration in a clinical pharmacy, that is the use of drug, that is with the medical use or apart from that is a drug abuse, drug misuse as well as the medication error. So medication error will happen at the time of writing of prescription as well as the dispensing of drug to the patient and at the time of administration of drug. So here clinical pharmacy help in the study of these. So it helps to overcome such abrupt and the rational and safe use of the medication. Next, that is education and training programs. So here clinical pharmacy is arranging such a training program like seminars, conferences, etc. So here clinical pharmacy plays a very important role to educating medical and paramedical staff on rational drug therapy. So it is very important scope of clinical pharmacies. And last, that is the patient care. So it is an first and prime responsibility of clinical pharmacy area to monitor the drug therapy, because all we are working to recover the patient as early as possible. So patient care is an first and prime responsibility of clinical pharmacy. So these are the scope of clinical pharmacy, that is evaluation of drug and the selection of drug, that is a drug information, drug utilization, education and training programs and the patient care. Let's move to the next. Here we will see the objectives of clinical pharmacy. So it is very important. So what goal the clinical pharmacy will work? Because thousands of drugs are available in the market. The scenario of clinical practices have been significantly changed with respect to or with respect of the emergence, because so many load on the physician, so to compel him to depend upon the clinical pharmacy or pharmacist for imparting drug and therapy related information exclusively to the inpatient. So the pharmacist may bridge the gap between the physician and patient by virtue of the objectives of clinical pharmacy, and those are as the first one. So it provides the platform to fellow pharmacists to interact with the physician to obtain better understanding of a prescription. So here the clinical pharmacy provides the platform to the fellow pharmacist. So what type of prescription which is written by that physician. So here the pharmacist, that is a new or fellow pharmacist, will understand better. Next, it gives opportunity to assist the physician in doing a better job of prescribing and observing of drug therapy. So here clinical pharmacy assists to the physician to write the right choice of drug to that particular patient. So it gives the opportunity to the clinical pharmacy as well as in observing of a drug therapy or monitoring of the drug. So clinical pharmacy also offers an opportunity to educate the patients. That is by using the patient counseling or with the help of patient counseling, here clinical pharmacy educate the patient as well as his relative on the prescribed drugs, its administration, route of administration, as well as the safe and effective use of medication and its storage. And here the clinical pharmacy creates an opportunity of clinical oriented researches and the development such as clinical trials, drug monitoring, etc. So these are the objectives of clinical pharmacy. I thought that you have understood this. So let's move to the next. So here we will see the healthcare team. What type of members which are coming in this healthcare team. So you can see in this screen. So these are the members which are comes under the healthcare team. So the patient, around the patient, these members are work. So in this first, doctor is there, as well as second one hospital pharmacist, third laboratory head, so fourth social worker, fifth nurse, and last the clinical pharmacist. So here each and every member will plays his important role for the patient care. So here the doctor will diagnose and give the treatment to the patient. So after that he is prescribing the medication to the patient. So here hospital pharmacist will prepare and dispense those medication which is written in the prescription to the patient. So here hospital pharmacist role is very important. So the diagnosis which is done in the laboratory. So here laboratory head role is very important. So whatever the diagnosis test which is written by the doctor, so here a laboratory will do that and send the report to the doctor. So that here that a report will help to give the treatment, further treatment to the patient. So next is there, that is the social worker. So here social worker is works in this particular team and coordinate and help to the patient as well as his family member or other team members. So here the social worker help the patient for getting the treatment with the proper cause. So next is there, that is nurse. So here the nurse role is a very important for the medication or for the patient care. So here it overall responsible to administer the dose with the proper route of administration. So nurse role is also very important in the healthcare team. And last, that is the clinical pharmacist. So clinical pharmacist role is very important, that is it help to the doctor on a prescription of a medication. Also the clinical pharmacist do the patient counseling with the patient on giving the prescription by the physician, and also clinical pharmacist help to the nurse also for guiding how to administer the dose. So these are members which are coming in the healthcare team. Each and every member plays his important role to patient care. So if you have any question, you can ask your question to me by using this mobile number, and you can also ask your queries or question with the help of email. At last, thank you very much.